You're listening to Beyond Wellness Radio, bringing you the cutting edge in health, biohacking, and sports performance. Stay up to date and listen anywhere and anytime on your computer, tablet, or smartphone by subscribing on iTunes. Catch your host, Dr. Justin Marcagiani, as he answers your burning health questions as well as interviews from world-renowned guest experts. For more Beyond Wellness Radio, go to beyondwellnessradio.com.
Hey there, it's Dr. Justin Marcagiani. Welcome to Beyond Wellness Radio. Feel free and head over to beyondwellnessradio.com where you can access our full podcast transcriptions. While you're there, you can also sign up for our thyroid and female hormone video series. This series goes into the root cause of why your hormones are out of balance. While you're there, you can also schedule a functional medicine consult with Dr. Justin, myself, where we'll dig deeper into the root cause of your health challenges. Feel free and think of sharing this podcast with at least one person. This podcast grows by people sharing it. Sharing is caring. If you can think of one person that can benefit from this information, please feel free and share it. If you're enjoying the podcast, make sure you subscribe on iTunes. You can also click below the video or podcast where you'll see the iTunes review button and leave us a review. You can also sign up for the newsletter at beyondwellnessradio.com where you'll get updates before anyone else. Thank you so much and enjoy the show. And we are live. It's Dr. J here in the house with Evan Brand. Today we are chatting about joint pain and functional medicine and how we can get people who have joint pain better. Evan, how are we doing today, man?
Oh, I'm doing wonderful. We were just looking through some stuff here about back pain, knee pain, hip pain. I mean, I would say if you did a survey of 100 people and you said, hey, do you have joint pain? I would say 90% of those people would say yes, occasionally. My elbow, my knee, my wrist, my ankle. I mean, the joints are, to me, one of the first thing that really deteriorates and shows that you're becoming unhealthy. It's not like your bicep one day just falls off and hurts. You know, joints, I think, go first before you start to get weak and decrepit and lose all your muscle mass.
100%. So when we look at joint pain, right, there's a couple elements. So we have the cartilage, which is kind of like the softer connective tissue, typically at the ends of the bones. So for instance, on your femur and tibia, right, where your knee is, you're going to have cartilage right in between here. You're going to have cartilage with the knees and the shoulders and the labrum on the shoulder. So you have this cartilage tissue, which is really important. That's a softer kind of connective tissue. And we need certain nutritional building blocks to help with that. Collagen is really important because we aren't typically consuming connective tissue building blocks like collagen, right? We're typically, a muscle meat type of culture, but we need to be consuming organ meats and also connective tissue. And we can get connective tissue by using a crock pot or an Instapot and throwing the full bone or knuckle of that joint in there. We can also get it through bone broth, and we can also get it through collagen amino acids, which are higher in proline, hydroxyproline, glycine. These are really important nutrients that we're just not getting. So we have cartilage connective tissue, and then of course we have the bone connective tissue. That's actually the structure, all the in-between connective tissue structure. That's the solid portion of the joint. So we have cartilage on the ends, and then we're going to have the bone in the middle. And the bone, people just think, hey, the bone's calcium, right? They say, hey, a bone looks white, hey, it's calcium. But there's about 12 minerals that make up a bone. Calcium is predominant, but there's other minerals too. And then people forget your bone is half protein. So if we're not eating adequate protein, or we are not able to digest adequate protein from food allergens or poor stomach acid or infections, we're automatically going to have deficits on the bone side and potentially the cartilage side. Typically, cartilage is easier because we aren't really getting that much cartilage connective tissue in our diets, but we tend to get more protein. But if we have other stressors going on, food, poor digestive support, infections, or just a poor diet nutritionally, we're going to have significant deficits.
I'm going to talk about some of the testing that we'll do with people when they come to us with joint pain, because there are functional causes that we can find. So it could just be, like you said, just a deficiency. If you look at Dr. Weston A. Price's book, one of the interesting things was that he said that when he was looking at these tribal cultures, they would feed the muscle meat to the dogs. I mean, muscle meat was just, yes, your microphone sounds much better now. He literally said this was not just him, talking to be funny. This was literally him documenting. He said the organs were the first thing that people would go for, and then boom, muscle meat, just boop, here you go, doggy. And now we pride ourselves in our grass-fed steak, which is good. But I think, we are super deficient as a whole. And I'm taking several different supplements. Now I'm playing around with some bone marrow supplements and other things. So I haven't been doing it long enough to give full feedback. I've been doing bone broth for, at least a few years, but I'm actually trying real bone marrow now and to see what happens, because I've had many people report good things.
But yeah, you're 100% right. So there's some supplements out there that will give you some of these building blocks, like you mentioned, some of the bone marrow, some of the organ meat, and some of the glandular meat, which I think is really important. Bone broth, collagen peptides are going to be great. Like in my line, we have a product called True Collagen. So collagen amino acids are wonderful. And if you have gut issues, I love the amino acids because they're already in broken down form. So 50% of the energy from protein actually goes into the digestive process. So there's an expensive transaction fee when you're digesting protein. So if you use an amino acid product that's in peptide form, you're going to be able to absorb more of it, and there's less stress on your gut. So, of course, we love collagen amino acid products, whole foods first, but in the meantime, if there's digestive issues or deficits in being able to break down those amino acids, good collagen amino acid products are great. Bone broth is going to be great. And like Evan said, there's some ancestral health products we use on the bone marrow side and organ meat side. We'll put some links down below. So if you guys want to access some of those, we'll put those links down below so you guys can see that. Anything else you want to highlight there?
Let's talk. Yeah, so that was it for the food section. Most people, I won't drop names, but most people, that's where their knowledge stops. They just say, real food, real food, real food. It'll fix everything, and then they stop. Now, let's take it to the functional medicine side and talk about testing. When joint pain comes up, we're going to be looking at different ways to measure some of this nutrient malabsorption that you just spoke about. So we could start talking about the stool test. We may be looking at pancreatic elastase. We may be looking at secretory IgA to look at gut barrier function. We may look at steatocrit, which is a marker of fecal fat, to see if someone's digesting their fats or not. So we don't have to guess and just say, oh, it sounds like this person's not absorbing, they need collagen supplements. No, we can prove it on a piece of paper with a combination of stool and urine testing. And if someone comes to us with joint pain, 90% of the time there's going to be some sort of infection. So why don't we talk about those, whether you want to dive into like bacteria, viruses, parasites, how that may affect joints.
Absolutely. So we can see joint pain with certain infections like cytomegalovirus or Epstein-Barr virus. That's very possible. We may see it with mycoplasma. Mycoplasma is one of these bacterial infections that can drive rheumatoid arthritis. So when we look at joint issues, I kind of draw a line, right? We have kind of the wear and tear of joint issues where you're just pounding that joint, whether it's exercise or just poor posture or stress. And essentially the buildup starts to drop and the breakdown tends to increase. So normally we have this buildup and breakdown, and as long as the buildup is at least even or a little bit above with the breakdown, right? Anabolic to catabolic, we're okay. All right. Now, over time, though, if the build up starts to drop and the breakdown increases, that's where we start to get osteoarthritis, and that tends to be bilateral, right? Now, with rheumatoid arthritis or the autoimmune side of the fence, so one side's wear and tear, the other side's autoimmune, then now we're breaking down our tissue, cartilage, our joints, and it's our immune system that's doing it. So it's not necessarily wear and tear. It may be. But now our immune system is coming to the party and it's starting to beat up the joint tissue. And of course, there's different markers that we can look at to assess that, but infections play a big role, like mycoplasma, like H. pylori, EBV, cytomegalovirus. So these are really important things to look at from a infection standpoint, because most people ignore the infection connection with a lot of these issues because they think of these infections as, hey, if I'm not tired or if I don't have digestive issues, I'm okay. So we may look at things like anti-nuclear antibody, like ANA. We may look at rheumatoid factor. We may look at the anti-citrullonated peptide, or anti-CCP. There's also ESR, which is erythrocyte sedimentation rate. That's a marker of inflammation. And we can also look at CRP, or C-reactive protein. These are really good markers of inflammation that's more associated with the joints. And CRP and ESR is more systemic inflammation markers. And then, of course, the optimal gut markers are going to be calprotectin for inflammation in the gut. Calprotectin's high, that's like CRP for the gut. And if we have inflammation in the gut, there's a really good chance that we're going to have gut permeability, and that gut permeability can drive autoimmune stuff, and that autoimmune stuff could potentially go after the joints. It could go after the cartilage, the bone, etc. So we really have to remember there's an autoimmune component, and there's also a wear and tear component.
Yeah, well said. That's what I wanted to mention is many people that come to us, they're not exercising. That's something we'll ask, what type of exercise are you doing, how much, how often, etc. And a lot of people with joint pain, they're not doing anything. They're more sedentary, but yet they still have miserable joints. And so we ought to tell the story about my wife about this is almost 5 years ago to the day. I remember because it was around the first of the year of 2015. So almost 5 years ago, my wife woke up one day and she had joint pain everywhere. Her ankles hurt, her knees hurt, her elbows hurt, and her wrist hurt, and she had trouble putting on her jewelry. And I thought, what the heck is this? It was very freaky. And so I said, hey, what do you think this is? And he said, well, I don't know. It could be XYZ. So that's when we ran the blood work and confirmed that it was mycoplasma. And per your recommendation, we had started on cat's claw and astragalus, two really, really good herbs that you and I love and enjoy for many reasons, but there is a sort of an antimicrobial, antiviral component to those herbs. And then, it maybe took like a week or two, and then the joint pain was perfectly gone, and it hasn't bothered her ever since. So it could have been a move, or she would have been pregnant at the time with our firstborn. She wasn't born yet, so she would have still been pregnant. Maybe it was a pregnancy change. There was some type of stress all of a sudden that allowed this mycoplasma to thrive and then take her down.
Yeah, we use those immune supports, and those significantly help bring down the inflammation from knocking down the infection. So that's an important one. The infections, I think, are just very, very easily missed, and we want to make sure that we are on top of that.
Let me mention Prevotella too, because we can't skip Prevotella. So Prevotella Copri, this is something that Justin and I both test for on the stool panel, and we've seen time and time and time again the link, and just look in PubMed for yourself, type in Prevotella RA, and you'll find that about 75% of patients with rheumatoid arthritis have a Prevotella infection, and if you get rid of that Prevotella, the joint pain magically goes away. Now, we're still going to be doing diet and all that. I actually did a podcast with a client of mine on psoriatic arthritis. She had terrible pain. She would cry every morning when she would put her pants on because of the pain. And with the help of an autoimmune protocol and addressing gut infections, her pain went from an 8 or a 9 out of 10 to like a 1. So the good news is you can reverse this stuff, but the problem is your doctor's not going to tell you about the stuff we're speaking about today. So these people just end up crippled, and it's really sad because you'll see a woman that's not that old, but yet she could be using a cane or some sort of other, apparatus. She's limping, and she, the lady's hurting, but she's never going to get this type of information, which is just sad.
Exactly. So in general, with the joint issues and infections, Prevotella, for instance, also Klebsiella is associated with ankylosing spondylitis, or AS, which is a autoimmune issue that affects the spine and will create arthritic-like symptoms in the lower spine and the sacroiliac joint. So ankylosing spondylitis is a big one.
Proteus, doesn't Proteus do something as well? I feel like we've had some education on Proteus being linked to something or another autoimmune wise, but I can't remember.
Yeah, there's definitely some autoimmune implications. Again, when you have various infections, the major mechanism is going to be gut permeability, and the gut permeability is going to increase your immune system. And then, of course, there's genetic predisposition to some of these conditions manifesting. So we always look at gut permeability, and of course, the big things are going to be gluten is going to be one of the bigger ones. Casein is the major protein in dairy. You're going to have less of it in butter and ghee. You'll have more of it in cheese and milk and such. So casein can be a big one. Of course, Roundup or glyphosate can increase gut permeability. Any foods that you're going to be very allergenic to that increase gut permeability will increase your chance of an autoimmune attack. And again, typically with the wear and tear, you're going to see those things happen unilaterally. You're going to see those things happen more unilaterally, typically, the wear and tear stuff. And then you'll see the autoimmune stuff happen more bilaterally because the autoimmune's more systemic, right? the immune cells aren't going to just attack one knee over the other. They typically attack both. Where the wear and tear stuff, the osteoarthritis tends to be more unilateral, one side versus both, typically, unless there's a unique wear and tear thing that you're doing that's affecting it equally. Most people tend to have one knee done before the hip, or typically they're not getting, both knees aren't in the same terrible position. So usually unilateral is going to be the osteoarthritis. Bilateral is going to be more autoimmune. So if you have bilateral issues, swelling in the joints, you're seeing a lot of nodes and bumps in the joints, typically that's going to be an autoimmune thing. And we can always do some of the conventional markers to test it. And it's nice because when we treat patients and we support them, we're not treating the disease, we're just treating the gut permeability and the inflammation and getting to the root underlying factors. A lot of these markers can go negative again. I've seen ANA and CRP and all these markers come down because we're getting to the root cause of the inflammation.
Yep, well said. Also, stomach acid. I think we should give a brief mention to stomach acid. We talked about some of the infections. Let's just say you have a bacterial overgrowth that's causing reduced digestive fire. So now you don't have enough stomach acid, or maybe you were doing a proton pump inhibitor. You and I could easily paint the picture of the link between using acid blocking medications, either over the counter or prescription acid blockers, and how that would lead to downstream joint pain or other issues, because now the foods that are rotting and putrefying in the gut, feeding the bacterial overgrowth, would then create more permeability, create more inflammation. So you could take your Zantac, your what's the other one? There's another one, Prilosec. You could take those and you could cause joint pain very easily by taking those. And people don't have a clue. And also, I need to just restate what you already said so people make sure this is clear. You mentioned glyphosate. Here's the problem. There's still tons of people, vast majority of Americans and other people in the world, in the developed world, eating conventional food. Conventional food should be titled chemical. When you go to the grocery and you see apples and it's conventional, and then you see organic apples, it's not just some special fancy food. People think, like, I've had this debate with people like, oh, organics know better. It's like, okay, look, all food was organic 100 years ago. So it's before glyphosate. I mean, my grandparents, they were eating organic food and they were eating grass-fed beef, and it wasn't a special label. So you got to know what you're eating. It's destroying your joints. If you're eating a regular apple, it's almost doing more harm than good to eat non-organic fruit.
Yeah, I had a lady in her 70s tell me that organic's a fad and this and that. I go, okay, so walk me through your thinking. So was it a fad up until the early 1950s or even late 50s when you were eating organic? She's like, I wasn't eating organic in the 50s. I'm like, you realize that that's all there was, because we didn't have all of the pesticides and the various chemicals till post-World War II, where a lot of the various pesticides were kind of byproducts of the technology from the war, and then we used these into the farming industry. We started applying them into the farming industry. So yeah, everything was, generally speaking, was organic up until late 40s, early 50s. So yeah, that's all you had access to. And it's like, people didn't wrap their heads around that because they never labeled the food back then, but it really hit a lot of that criteria. But people are kind of a little bit, they don't have that level of awareness to know how that came about, what the timeline was like.
It's a massive change that has happened in our food supply that many people just turn a blind eye to. I read an article the other day, which was pretty scary, about the world of pollinators and the fact that all these insecticide chemicals in the last 20 to 30 years, the world has become 50 times more toxic. There was some crazy number to pollinators. And I saw this other article that Scientific American put out that
when you say a pollinator, are you referring to
bees and butterflies mainly. Yeah, bees, butterflies. Yeah. That for pollinators in general, that the planet, or at least America, has become 50 times more toxic in the last 25 years. I think that was the number. And then just over the weekend, I saw an article from Scientific American talking about the amount of birds that have been lost. They said they call it the silent extinction of birds. And since 1970, we've lost over 30% of all birds in America. Now, some are doing better, like raptors. We've put in protection for raptors. So, your hawks and bald eagles and all that are making a quite good recovery, since we're not using DDT and other things that destroyed them. But in terms of your small birds, your songbirds, they're dying out and disappearing because of our use of agricultural chemicals, which are killing the insects and messing up the food chain. So basically the birds are just starving and disappearing, and the populations aren't sustainable because of all the bugs are dead, because of all the chemicals. So we're extincting ourselves, but we're extincting everything else too. So just think about when you're paying the extra $1 to get organic strawberries versus conventional strawberries, which have an average of 22 different chemicals in them. You're helping yourself, but you're helping everything else too. So if you care about the planet that you're going to leave for your kids, do organic. Even if you don't care about yourself, hopefully you care about your kids, and you can do organic to protect their future.
Yeah, I mean, there's a lot of environmental causes out there, and some are like, are they true? Are they not? But you have a direct control over buying food that we know has chemicals used to grow them, and those chemicals affect animals and can get into the groundwater. We know that directly. So if you just don't buy those foods, then you're having a positive impact on a lot of those chemicals getting into the water supply and affecting animals and people that drink that water. So that's the easiest first thing you can do, is just buy healthier quality food. That's your best impact on the environment. And then, grass-fed organic meat, because you're going to have less junk produced by the animals when they're eating corn and grains. So that's going to be a huge impact. Now, go ahead.
I just want to say one thing about the meats too. So I love getting on this rant about food quality and getting away from chemicals. But remember, how this could tie back into joint pain is the fact that if you're eating, quote, conventional meats, those meats are going to have antibiotics in them. Those antibiotics in the food supply kill the good bacteria, and then you get bacterial overgrowth like the Klebsiella, and then you end up with Hashimoto's or some other autoimmune condition because of the meat. So make sure hey, my joint pain could be due to me eating, a Hardee's or other fast food burger. It could be directly correlated.
100%. Also the fact that we know any joint issue, there's going to have to be in the environment excess inflammation in your body, right? Because inflammation is what accelerates the breakdown. And then healthy anti-inflammatory hormones or nutrients is what accelerates the build-up. So when you start to break down faster than you're building up, inflammation has to be part of that. So that omega-3 to omega-6 ratio is going to be a big component. So animals that aren't fed grass-fed nutrients, they're going to have more omega-6. Lots of refined vegetable oils are going to have more omega-6. Not having good quality fish or omega-3 supplementation, or consuming good egg yolks from pasture-fed chickens. Like, you just got to look at that omega-3 to omega-6 ratio. You want at least a 1-to-1 or even a 4-to-1 is okay, meaning 4 times the omega-3 to 4 times the omega-6 to 1 omega-3 is acceptable. Ideally a 1-to-1 or a 4-to-1. And you can do that by just consuming good quality fish and seafood, or a good quality omega-3 supplement as well. And then just make sure the animals that you're consuming are going to have pasture-fed kind of sources. So grass-fed cows, chickens that are kind of free-range and pasture-fed where they can eat bugs and such, they'll be able to produce a much higher quality yolk. So that's going to be a big component with that.
Let's go back to lab testing just for a minute, because I only talked about the stool. Let's spend a few minutes on labs, and then let's talk about some herbs or other nutrients that may use to help joint issues.
Absolutely. So with certain nutrients there, of course, collagen is going to be number one. Typically, hyaluronic acid is going to be part of the collagen byproduct, okay? You can also do things like magnesium and calcium will still be helpful. Vitamin K is really important because that's going to help get that calcium into the bone. So we need to make sure that we have good vitamin K, ideally K2, which is going to come from quality animal products. So if we can consume things like egg yolks and grass-fed butter and ghee, that's going to be essential. If we have problems with butter or ghee, then we probably want to look at making sure we supplement that, or get it from a good quality fermented cod liver oils. We got to keep an eye on if we can get good quality butter or ghee in there. You're probably going to be okay with your K2. If not, we'll have to supplement that. I would also say just making sure you have a good multi to get all those extra other minerals that we need, like selenium and zinc and calcium, magnesium are going to be typically separate. And then, of course, you're going to have copper. And of course, your fat-soluble vitamins are going to be very important. So you got to make sure those are all present, your vitamin K2, etc. As a female, especially as you get older, lower levels of progesterone and estrogen before menopausal age are going to be a detriment, because progesterone helps stimulate osteoblasts, which help build up the bone. Estrogen helps stimulate osteoclasts. So if we start getting more estrogen dominant, we're more likely to be breaking down the bones. And then as you go menopausal, you want some level of hormone support to help support bone health, because going super low, that's going to prevent your body from building healthy bone. So making sure the hormones are dialed in and making sure we're testing the hormones is going to be ideal. And then, of course, resistance training is going to be helpful, right? We grow, our body adapts by demand. It's what's called the piezoelectric effect, where you can stimulate bone building through stimulation, whether it's resistance training or whole body vibration or using bands or doing some kind of an interval on a elliptical or a rowing device. Something like that's going to be very helpful to stimulate healthy bone growth. So we need that as well. And then I would say last component is making sure your joints are pliable, making sure your muscles are pliable. Your muscles are shock absorbers for your cartilage and for your bones. So if we have excess of wear and tear because your muscles or your natural shock absorbers aren't working, that's really important. So, you can get your muscles turned back on with applied kinesiological techniques, various soft tissue techniques like myofascial release or ART or Graston, or like muscle spindle techniques, or we can even use bioelectric devices like the Newbie, for instance, which really help stimulate the muscles so they can work again. They help reduce inflammation. All these things are helpful. Seeing a good chiropractor that can test your muscles to see which ones are on or off can be helpful, because a lot of people that have a joint issue at the knee may have issues at the ankle or the hip above. So a lot of times where joint issues manifest, the problem is usually above and below the joint, and that gets ignored. And you see a physical therapist and they only want to work on the knee. They don't go upstream or downstream. So kind of like in functional medicine, we're always looking upstream. If you're working with a good PT or a chiro, you want to make sure you're looking upstream from just the knee. Hip and ankle, you got to look at both of those places. If you have an issue at the hip, you want to look downstream at knee and ankle, and upstream at the back. So you got to look at this holistically.
Yep, well said. A lot of great points. Other supplements too. We like to use curcumin, turmeric extracts.
Liposomal curcumin, yep. CBD oil is excellent for extreme pain. Some people do better with a little bit of THC in there, but I try to do mostly CBD initially, and then we can topically rub CBD on the joints as well, which can be helpful. Systemic enzymes with serrapeptidase and nattokinase or lumbrokinase in between meals, away from food, to help with inflammation. Go ahead, I kind of cut you off there.
Yeah, no, you're fine. You're excited. I love it. Digestive enzymes too. We always like to throw in enzymes. We talked about the connection of low HCl, bacterial overgrowth, joint pain. So extra enzymes could be helpful. And then testing. So I keep wanting to talk about testing. So stool, that's going to be our first thing. Organic acids, we can look at amino acid metabolism, and then some of this viral and co-infection testing. So Mycoplasma, Epstein-Barr, the cytomegalovirus, that would be something you could find on a blood panel. So you may need to get blood, urine, and stool to really get to the bottom of your joint pain.
100%. So also, there's bioelectric devices like I mentioned called the Newbie. We'll put some links below for some of these things. All the nutrition's really helpful. Autoimmune gut stuff's really helpful. And then I would say if you're end stage, you definitely want to be working at all these things together, and you may even want to be adding in some stem cells. If you're trying to avoid surgery, you probably want to be incorporating some stem cell therapy along with it. I've seen that work miracles and significantly help improve patients' ability to heal. You can also do prolotherapy, which is like an injection of like a mannose or a dextrose sugar, which kind of creates an inflammatory response, which then stimulates the immune system to help kind of heal that area. Those work too. I tend to favor the stem cells over that, just because of what I've seen on the recovery side. So those kind of give you a couple of really good options. But the soft tissue component, I find, is what most people, chiropractors and physical therapists, they ignore. They ignore the pliability component, and they don't get the soft tissue working or pliable again. So think of your muscles as like shock absorbers. It can either be a soft tenderloin kind of spongy spring, or it can be beef jerky, right? Beef jerky is not going to provide any level of cushioning. It's going to just tear. We want the soft, springy kind of tenderloin for your muscles. So kind of think about that. You want to train and get therapies that help make your muscles into that softer sponge.
Yeah, I've seen insane results with stem cells. I haven't used them, but I've had clients that have used them, and we've seen countless stories of athletes, professional athletes, where they were going to end up getting like rotator cuff surgery. They do stem cells instead, and they're fine.
Yeah, at some point I will do some level of preventative therapy where I just go out of the country and just get stem cells injected everywhere in my body just to promote healthy living and healthy tissue recovery. Not yet. I'm still in great shape health wise and age wise. So I'll probably, but somewhere down the road, maybe the next decade, I'm thinking about it just for preventative support.
Would you have to go out of the U.S.?
There are some places in the U.S. There's some doctors in Vegas. There's some doctors up in the Northwest as well. I know Tony Robbins talked about going down to, it's not Argentina. I think it's Peru or Panama. I think maybe Panama is the spot a lot of them are going.
Oh, okay. I wonder why. Is it cheaper or they're better
I
at it?
I think a lot of it has to do with the regulation. So a lot of times they'll do cord stem cells. So, which is good, it's not, you're not taking any babies that are aborted or anything. So they're using cord stem cells, and that's where they're extracting it from. So there's, a greater supply of that because every baby that comes out has that cord. I think we even donated our cords for stem cell purposes for burn victims and such. So there is that, right? So you can extract those stem cells from that, and then they inject it, and they can do it IV or they can do it localized. So I know people may do both. So those are helpful places. I know in the U.S., some people are starting to do it. So there's a couple places I saw in Dallas, in the Northwest, in Vegas. There's a good podcast with Mel Gibson on the Joe Rogan podcast, and he talks about stem cells. And his dad's shoulder injury got significantly better, and Joe talks about stem cells on that one. So that's a good little podcast if you want to look at the stem cells.
Cool. Yeah, I don't know enough about it to do a whole podcast on it, but I am fascinated by it, and I have heard good things about it.
Exactly. So I think we hit the stem cells, we hit nutritional component, we hit collagen, we hit the autoimmune, we hit the gut component. A lot of these things you're going to need a good functional medicine doctor to do a workup on to get these things better or to kind of line everything up and create a priority list. I've had some patients, though, honest to God, people that have had destructive arthritis for decades, and we just cut like grains out, and it was like magic. So sometimes one issue could be everything, and sometimes it's a combination of everything combined, and you don't know. So we kind of have our algorithm and how we work through things. We do a really good history. We kind of prioritize what's going to be the best bang for our buck. We have the foundational things. We start with diet and lifestyle, and then we kind of work up with testing and assessment, and we kind of start from there. And sometimes we hit a home run, like, we're at the plate, we're calling our shot, and we hit a home run right away. And sometimes we have to get a lot of singles in there to start scoring.
Yeah, well said. It's crazy just pulling grains out, how effective that could be. It almost seems too good to be true. Yeah, and it's not always, like you said. Sometimes you got
Some patients it's not. Some patients it's a long, steady road of doing a lot of different things. Like we're getting a lot of singles to get some runs. Sometimes we hit a home run and we feel like $1 million doing it. So, you kind of have to, it's tough because if you're an individual and you had one experience of this being it, you tend to associate that's going to be the same thing for everyone. And because we work with so many patients, we know it's not the case. We're a little bit more humble because we failed so many times and had to get more creative to get these things working.
And you like you said, you may get 5% with the diet and 5% by fixing the gut, and then all of a sudden you knock out some of these mycoplasma load, and boom, you got 65% better in a month.
And then the person's sleeping better, and they're getting an extra hour or two of sleep, and then they're cutting out the alcohol, and then maybe they're digesting their proteins better, and they're having regular BMs, and it's like, oh, wait a minute, like 5% here, 2% there, 10% there, and then a year later, they're 60, 70, 80, 90% better.
Yeah, it's a miracle. I mean, the body does have a wonderful capability to heal itself if you give it the right nutrients, the right tools, and you remove the roadblocks. See, that's a lot of what we do is finding the roadblocks, because you can't fix what you can't find. So the hardest part is finding it, getting the workup done to where you find what are you up against, because you could go take every joint supplement known to man at the grocery store and not get any better because you didn't find what you're up against. So now you're building up that supplement graveyard.
100%. Now, in general, there are conventional drugs that are typically going to be used, like Boniva or a lot of these supplements that are going to stimulate bone growth. The problem is a lot of the bone growth is kind of haphazard. It's not as good quality bone. So I typically don't recommend a lot of the medications to build back the bone because it's not going to really be creating good, healthy, strong bone, number one. And then there's a lot of medications that are like anti-inflammatories or even steroids, which may not actually fix the problem and have their own whole host of side effects, with gut issues or liver issues, or even actually breaking down the bone and creating more inflammation, especially with steroids, and may thin out your bones even faster and even drive blood sugar issues too. So you got to have to weigh out the options from a medical standpoint. There's also methotrexate, which is like used for immune issues, but it's actually a chemotherapy. So there's other medications that can have a lot of side effects with it. There's I think it's Plaquil. That's going to be used a lot of times for inflammation in the joints, as well as blood issues too. So I've seen that help too. But again, there's side effects, and a lot of it's not getting to the root underlying issue. We want to get to the root issue. So we want to have a good functional medicine kind of workup and how we get to the bottom of it. And of course, there's other stressors like heavy metals that could be an issue. And then, Evan, with mold and mycotoxins, that can create a stress on your body too. So it's not the first thing I look at when we have joint issues, but it's kind of in our algorithm, and it's there, and we eventually get to it, but we try to prioritize based on symptoms, based on history, and based on the timeline of how we got here.
Yeah, and also you may find that you have a relapse after a big stress. So that would clue you into maybe a viral component. So like if you just had a baby and then you got joint pain, or you had a death in the family and you got joint pain, or you had a divorce and you had joint pain.
The more acute, for sure.
Yeah, so you got to kind of peel back the layers of it. Were there any questions that you wanted to hit?
Oh yeah, let's take a look at questions here and try to engage. All right, cool. So if you guys are listening at home and you are enjoying the podcast, give us a thumbs up right now. Give us a share. We appreciate it. We also love getting reviews. JustinHealth.com/iTunes, EvanBrand.com/iTunes for a review. We appreciate it. Let's dive through questions here one by one. If it's a repetitive question or it's not as relevant for the crowd, we'll probably just skip it. I have hip pain every 3 years. What are my options? All the things we just mentioned. How to handle glutamate. So a lot of collagen is very high in glutamine, which can convert to glutamate. So I'd work on just getting the inflammation under control first before you do that. If you can do collagen, that's great. May want to try a marine-based collagen or a fish-based collagen to see if you can deal with that over the bovine source if you are having issues. If you want to chime in, Evan, just chime in. I'll try to get to the more meaty questions for you.
No, you're doing good. I think the advice on the glutamate issue is good, and look at the gut, because most people shouldn't react to glutamine type conversion issues like that. So there's probably something else underlying that's causing that.
Yeah, and if you're having issues, I would just say focus on reducing inflammation more first with digestion, gut, anti-inflammatory herbs, all the diet and lifestyle things, and then come back to it in a month or two if we're having issues, and work into it. Start with like 1/8 of a teaspoon and then just kind of nudge your way up.
Yeah, here's a question from Riley. How beneficial is physiotherapy for joint pain, arthritis? My mom has chronic arthritis in her lower back and hips. I mean, I've been to physiotherapy before. I got minimally better with it because it wasn't root cause. So I would say if your mom is eating grains, step 1, get her off grains. Step 2, look at her gut. Is she moving? Is she sedentary? Get her, some good omegas may help. Some turmeric extract may help. Some boswellia, those type things.
Not all chiropractors or physio are root cause based. So like the average chiropractor, hey, there's back issues, I'm going to just adjust your back. Or the average physio, there's knee issues, I'm going to just exercise the knee. That's the wrong way to do it. You may still do that, but you may be looking above and below. So when I was doing more chiropractic therapies, I would test the joints. I would see how the muscle integrity at each joint was above and below before I provided any therapy, because I want to make sure all the muscles in the kinetic chain are working. And then if you're going to move the joint, well, that's fine, but you also want to make sure the soft tissue and the muscles are activated. And if you're going to exercise a joint as a physio, well, you want to make sure the muscles are more pliable, because imagine having a knot in a string. If exercising that muscle is the equivalent of pulling that string tighter, well, guess what happens when there's a knot there? The knot gets tighter. So you really want to undo the knots, in my opinion, professionally, before you do a lot of exercise. So that's where the soft tissue therapies are really important, and that's where making sure the joints are moving. So there's good chiros and bad chiros. There's good physio and there's bad physio. My biggest thing is make sure whoever you're seeing is addressing the soft tissue, and make sure they're looking at the joints above and below. And if they can do some muscle testing, that's great. That way you can objectively see and feel the muscles in and around that area getting stronger, which is great.
Yeah, here was a question here. I like this one. Going off of Evan, what would come first, hypochlorhydria or dysbiosis/bacterial infection? I think it could go either way, right? So
it can, but I typically find, and this is just generally speaking, there's exceptions to every rule, is there's some level of stress that happens. That stress compounds and activates the sympathetic nervous system. Then you have less stomach acid and enzymes, and then it's greater risk now for bacteria and critters to kind of come in there. It could also be something like you took an antibiotic and that drove rebound bacterial overgrowth, and then that started driving all of the hydrochloric acid or enzymes. So it could go both ways, and it's all going to be about the history.
Exactly, yeah. That's what I was going to say. In the case of bacterial overgrowth happening before stomach acid, there's going to be an intervention of some sort, like antibiotics.
Exactly. Wonderful girl writes in, swelling of legs and feet, sign of inflammation. It comes from joint problems after operation for artificial hip, recovery period 5 months. What do you think? Okay, so in general, yeah, you got to just do all the things that I mentioned. When people have these kind of if they already have their joint replaced, you still want to do all the same things, because just because you had your joint replaced, the kinetic chain of imbalance, like let's say your hips replaced, right? Well, are the muscles working good in your glutes? Are the muscles working good in your knees and your back? So just because you fix the joint, those muscles are actually still not fixed. And they actually may be worse because now you cut open to the body, and now there could be subclinical inflammation from just the surgery, and the muscles could be more inflamed now because of all the surgery. So you need to even more work on the soft tissue component and the kinetic chain. All right, let's dive in a little bit deeper. The mold question's not really related here. Best heavy metal detox supplements, not related to this podcast, sorry. Where to get stem cells. Panama is a good place. There's some places in Dallas and the Northwest. Heavy metal support, not going to go there. Let's see here. Yep, we did a podcast on that. A friend is allergic to L-glutamine and protein or lectin in fresh fruit and vegetables. Don't remember which one. Okay, so this is really important. So I've seen people who are very allergic. I'll just give you one person to look up, Mackenzie Peterson. Mackenzie Peterson has a significant autoimmune issue. I think in her early 20s, she had both knees and hips replaced in her early 20s. And she had significant autoimmunity, and what she needed to actually help decrease her autoimmunity was full carnivore, because she was actually very sensitive to even the lectins in fruits and vegetables. So she needed to be grain-free and autoimmune, right? But she also needed full carnivore on top of that, meaning only high-quality meats and fats, and that really made a huge difference in her life.
Yep. Her name's Michaela.
I'm sorry,
Michaela.
Yeah, Michaela Peterson. Yeah, that's Jordan Peterson's daughter. Correct.
Yeah, question, what do you think about the hyaluronic acid joint supplements? I mean, it could be a part of the puzzle, but I wouldn't put too much faith into just that by itself.
You'll get some of that, I'm pretty sure, in collagen, for sure. You'll get some hyaluronic acid from the collagen, too, for sure. Yeah, and then also vitamin C is really important for building up the collagen, too. Vitamin C is an important cofactor. So you can get vitamin C separate, and then also you can get it from the collagen as well. Or, sorry, you can combine it with the collagen as well. That way your body can make collagen as well as have the collagen building blocks. So you kind of combine the two.
Yep, perfect. Well, that was all the relevant questions. So let's wrap this thing up if you're ready. If you're suffering, there's probably a reason. So if you want to reach out to Justin, we do testing around the world. So no matter where you are, we can help you with this issue. If you want to reach out, Justin's website's justinhealth.com, and my website is evanbrand.com. And either way, whether it's one of us or somebody you're already working with, we just hope that they're getting to the root cause and helping you, because there are solutions, and there's so many people that, you know, we're talking about an issue that affects your quality of life. You know, people that want to go hiking and biking and go to national parks and be mobile. You know, I think we get focused on the health issue, but it's important to look back at what are we trying to help people achieve. We're trying to help people achieve playing with the kids. You know, the grandparents that have grandkids and they want to be mobile and active with the grandkids and keep up with them. You can't do that if your joints hurt. So this is an important topic that affects how you navigate through your life.
Yeah, exactly. I'll give a shout out to my friend and colleague, Garrett Salpeter over at NewFit in Austin. So NEU.FIT. is the website, neu.fit. We'll put the link below. He does a lot of this work as well. He has his own bioelectric device that I have different versions of that really work well with stimulating healing, helping to activate the muscle, helping to improve blood flow, and getting the muscles to work really well in that kinetic chain. Muscles work like a domino, so if you're missing one of those dominoes in the middle, that chain doesn't work appropriately. So Garrett's a great person to reach out to. We'll put his links down below, and just make sure you let him know that we shot you over here from his podcast. Appreciate that. All right, anything else you want to mention, Evan? I think people are liking this. Sharing is caring. We appreciate it. Thumbs up. That gives us a little boost on the YouTube algorithm. And if anyone wants to reach out to us more on the metabolic or functional medicine side, click down below and you can schedule online.
I think we covered it all. I'm sure we could rant about something else, but I think we did a great job of looking at the nutrition, the gut, infections, viruses, testing, herbs and nutrients. You briefly hit the medication. So, no, I think this is plenty good to wrap up.
I'll do a little summary video on my side here if people want to get the condensed version. But if you guys appreciate it, put your comments below. Let us know what you guys have done to help improve your joint and your overall inflammation in your skeletal system. We appreciate it.
We'll take good care. We'll chat next week.
Evan, you have a good day, man. You take care. Bye now.
You too. See you later. Bye.
Bye.
Got a question for Dr. J? Go to beyondwellnessradio.com and click the questions button. Then tune in to hear the answer. Also, if you like the show, click below to review us on iTunes. For more Beyond Wellness Radio, go to beyondwellnessradio.com.